Table 10. Portraying persons with disabilities in the media. As an organization becomes more inclusive, opportunities may arise to portray its diversity of staff, services offered, and other capabilities in the media. The media and public relations departments in organizations have a responsibility to ensure that they engage with and portray persons with disabilities with dignity and respect. Tips for reporting or writing about persons with disabilities. When referring to individuals with disabilities, use the word disability, not handicapped. Emphasize the person, not the disability or condition. Use the phrase persons with disabilities rather than disabled persons. For example, persons with epilepsy rather than epileptics. See Table 2 for suggestions of appropriate terminology. Omit any mention of an individual's disability unless it is pertinent to the story. Depict the typical achiever with a disability, not just the super achiever. Choose words that describe accurately and have non-judgmental connotations. Engage with persons with disabilities as resources to provide correct information and terms, particularly to avoid stereotypes in the media. Persons with disabilities live everyday lives and should be portrayed as contributing members of the community. These portrayals should depict persons with disabilities experiencing the same pleasures or pains that others derive from everyday life, in brackets, including work, parenting, education, sports and community involvement. Feature a variety of persons with disabilities when possible, not just someone easily recognized by the general public. Depict employees or employers with disabilities working together. Portray persons with disabilities as people with both strengths and weaknesses. Interviewing persons with disabilities. When interviewing a person with a disability, relax. Conduct your interview as you would with anyone. Be clear and candid in your questioning and ask for clarification of terms or issues when necessary. Interviewing etiquette. Shake hands when introduced to someone with a disability. People with limited hand use or artificial limbs do shake hands. Part 2. Situation Overview. In this section, key observations of disability issues in Nigeria. Gender and inclusivity. Table 12. Ensuring the protection of women with disabilities. Inclusivity is a right. Representation and protection of persons with disabilities. Did you know? Women with disabilities experience the highest rate of personal violence at the hands of spouses, partners, boyfriends, family members, caregivers, and strangers of any group in our society today. Source: Abramson et al., 2000. Best practice fact. The National Emergency Management Agency, NEMA, with the guidance and support of the National Human Rights Commission, has developed a mechanism to address the needs of the most vulnerable members of society during crises, disasters, and emergencies. In 2010, the Vulnerable Group Care Unit was created with a mandate to prepare appropriate emergency responses and contingency plans targeted at preventing, mitigating, and responding to the suffering of vulnerable groups before, during, and after disasters and crises. Update various disaster management policies and programs as they relate to vulnerable groups in Nigeria. Implement strategies for the reduction of disaster risk affecting vulnerable groups in Nigeria. Key of disability issues in Nigeria. In Nigeria, there are over 19 million people with disabilities, but no systematic institutional arrangements to address their needs within the framework of a rights-based approach. A lack of robust and reliable disability data means that the concerns of persons with disabilities are not adequately captured or recognized. Consequently, resources are not adequately budgeted for or administered. The instinctive responses in policy and practice have generally been welfare or charity-based. Policymakers have shown a measure of sympathy, but not much empathy or action. On the other hand, OPDs have been active in advocating for institutional recognition of the rights of persons with disabilities, adequate resources, empowerment, and understanding of the rights-based approach. They have had limited success in effectively advocating for inclusivity. A closer scrutiny of the reasons for the disconnect between intentions, policies, and progress towards mainstreaming disability reveals that challenges exist both at the structural and the implementation level. We observe three key issues which affect the development of disability rights in Nigeria. 1. Political will. The Nigerian government undoubtedly faces many development challenges. Unfortunately, it has not ascribed sufficient importance to disability as a developmental issue. The government has therefore failed to take a concerted approach to mainstreaming disability. The political will to do so is sorely lacking. For instance, although the 1999 Constitution of Nigeria guarantees the fundamental rights of every Nigerian, it does not have any specific clause relating to the rights of persons with disabilities. Source: JONAPWD, 2008, page 4. Furthermore, the disability agenda has been placed with other issues under the Federal Ministry of Women Affairs and Social Development, with no clear plan for comprehensive action. Issues of underfunding and the absence of a targeted rights-based strategy have hindered the process of including disability issues in the policies and programs of the Nigerian government. And a lack of focused policy making by government has resulted in confusion regarding where responsibility lies in mainstreaming disability, with various ministries shirking their responsibilities for addressing the concerns of persons with disabilities within their programs. From a legislative perspective, persons with disabilities in Nigeria have been grossly underrepresented in legislative processes and outcomes. However, strides forward are being made, as seen by the recent harmonization of a disability bill, which has been passed by two chambers of Nigeria's National Assembly. The bill aims to ensure total inclusion of disability issues into the policies and programs of the Nigerian government. Unfortunately, this laudable achievement has been overshadowed by the slow pace at which the bill is being processed into law. The bill currently remains with the National Assembly in a bureaucratic queue. It is yet to be sent to the President for his assent, which would make it a law. However, it is hoped that the disability bill will be ratified into a law before the 2011 elections. 2. Organizational practice. Many international and national development agencies within the country have established disability policies at the central level. However, progress in mainstreaming and inclusivity has been slow due to ineffective communication of policies and an absence of oversight mechanisms and resources to facilitate action. Additionally, within development organizations, disability is often considered a specialized issue. Staff members are often at a loss as to how to develop practical ways to include persons with disabilities into their programs. Some organizations have dedicated disability teams, but even these tend to be inadequately prepared to embed disability inclusivity within the organization at large. And as mentioned earlier, budgetary constraints also limit the effectiveness of disability-related initiatives. Rather, disability continues to be addressed as a social welfare issue. The approach is that of service delivery instead of mainstreaming the issues and concerns of persons with disabilities into core programs. Organizations of and for persons with disabilities. The disability movement in Nigeria, although vibrant, is at a nascent stage. It needs to be further strengthened to enable persons with disabilities to effectively present their concerns and claim their rights. Organizations of and for persons with disabilities have themselves been heavily influenced by the charity-welfare model approached to by disability. A 2008 scoping study by the UK Department for International Development, DFID, observed that few OPDs in Nigeria have a clear understanding of the social model of disability, which in turn results in the adoption of inappropriate advocacy and campaigning strategies. Within their campaigning and advocacy activities, OPDs have tended to focus on tackling environmental barriers rather than dealing with the more deep-seated institutional and attitudinal barriers. As a result, to date, the disability movement has not really made any significant progress in taking forward a rights-based approach to disability. Source: Lang and Upar, 2008, page 20. The study was led by Dr. Raymond Lang, Research Fellow at the Leonard Cheshire Disability and Inclusive Development Center in the United Kingdom, and Ms. Lucy Upar, a volunteer at the Joint National Association of Persons with Disabilities, JONAPWD, in Nigeria. Despite constitutional guarantees of equality and rights for all citizens, persons with disabilities in Nigeria continue to experience many obstacles and barriers to their participation and inclusion in all spheres of life and at all levels. With neither an independent vehicle to drive their cause, nor representation at the crucial decision-making levels of government, persons with disabilities continue to suffer discrimination, marginalization, and exploitation. A message to the government. David Anyele's story. David Anyele's story is nothing short of a miracle. David, an amputee from Abia State, survived the war of attrition that ravaged Liberia years back. However, he returned to Nigeria without his hands, which were hacked off by child soldiers on the orders of the then Liberian president, Charles Taylor. The cruel and heinous act was intended as a message to the Nigerian government to stop meddling in the affairs of the war-torn country. Today, David is advocating another message to the Nigerian government: respect for the human rights of persons with disabilities and empowerment of these people through effective rehabilitation services. As an amputee, David is all too familiar with the limited and under-resourced services available in Nigeria. He is still yet to raise enough funds, in brackets, 35,000 euros, plus flight tickets, accommodation, and sundry expenses, to travel to Germany, where he will be able to get artificial limbs. Through his advocacy work, David aims to draw the attention of the Nigerian government to the poor state of rehabilitation services and support in the country. His rights-based advocacy for government-supported rehabilitation is a key element in the struggle for disability inclusivity. As David points out, without rehabilitation, you cannot talk of inclusion. It is someone that is rehabilitated that will demand to participate. Without rehabilitation, you cannot be stable emotionally, medically, psychologically. Without stability, you are not in a position to demand for your rights to inclusivity. David wants the Nigerian people and the Nigerian government to realize that rehabilitation is not a one-off event, accomplished by the distribution of wheelchairs or artificial limbs. Rehabilitation is a continuous process that includes acceptance of one's disability, physical and emotional healing, and the psychological fortitude to plan for the future. This understanding, along with a strong social support system, David says, is key to successful rehabilitation. David's successful rehabilitation has empowered him to fight for those who are unable to fight for themselves. He continues to advocate for the government to give due attention to rehabilitation systems in Nigeria by scaling up the budget for services and support. David Anyele is the Executive Director of the Center for Citizens with Disabilities, formerly the Amputees Rehabilitation Foundation.